And good morning to you. Our conversation with Dr. Al Johnson is brought to you by Marcus and Mack, a law firm representing injured people. And Dr. Johnson in Dallas, Texas, as we talk about allergies, COVID, and all of the issues that surround them both. And practically anytime we get a nose sniffle right now, we're wondering, is it cold? Is it COVID? Is it the flu? Is it COVID? Is it allergies now? Or is it COVID? Dr. Al, there's sometimes enough overlap there that we're just not sure, are we?
Exactly. Generally, allergies has a clear runny nose, itchy eyes, maybe a little cough, nasal congestion, where COVID has more flu-like symptoms of chills, fever, maybe a cough and a sore throat. So there is that. And now many people have home tests so they can test themselves for the COVID.
Dr. Al is a doctor of internal medicine. He's in Dallas, Texas. Are allergies, particularly the airborne allergies that you get from pollen, are they a big problem in Dallas as they are here in Pennsylvania?
Yeah, exactly. We get a lot of weather changes, fronts coming in. So we get pollen from the south, pollen from the north, and I'm sure you do too here in the spring. And so they can change. But most of the pollen is grasses and trees as the trees bud out.
And am I correct when I say it seems like more people have allergies for pollens and other dusts and things in the air, it seems, than ever before? Because they just seem to be everywhere now, and it seems like everybody has them.
Well, they do. They've kind of protected themselves for the last couple of years wearing masks. And so when you get re-exposed, your body may react more from the allergic factor. Mm-hmm. You've lost some of the tolerance. Other times, people who've had COVID, it's flared up their immune system so that now they are more sensitive post-COVID, so they have allergies that they didn't recognize before.
See, that was one of the things I was wondering about, and I was going to ask you about, is we know that COVID affects us initially when we have it, and we're still and only now beginning to get a grasp of what the long-term effects are and how COVID interacts with other of our common maladies, and allergies certainly be one of those, especially being as they're both respiratory related. So you're saying that, yes, having had COVID or been exposed to COVID can be something that can affect you in terms of your allergies.
Well, having had COVID, it does affect, one of the things it does is affect your immune system. And when it does that, you can flare up underlying conditions also. And so that's what some of the long haulers are experiencing, is trying to figure out, well, why am I having these symptoms now, and why is this hanging on? Sometimes it's directly due to the effects of COVID, and then other times it's due to the effects of COVID plus whatever else their body was dealing with, but now is having a harder time dealing with it, such as indoor mold exposure and exposure to mycotoxins. It flares up the inflammatory system and then makes you more sensitive to what you're exposed to indoors or have been exposed to indoors.
Yeah, it's kind of interesting that you put it that way, because allergies are something that you can have avoided your entire life, but all of a sudden as you reach a certain age or as conditions around you change, you become someone who is afflicted with allergies. Is that correct?
Correct, yes.
Oh, my goodness. All right, so obviously when you get out in public and you're sniffling and you're sneezing and you're blowing your nose all the time, people naturally are going to look at you and wonder, okay, is that somebody I need to avoid because they have COVID? And there is that certain stigma that gets attached to people, isn't there?
Oh, yes. And, now kind of in the transition period of what we're seeing, it does make sense not to be close to those people who are coughing, sneezing. I think most people are aware of that, and then they stay away. Mm-hmm. So people are being very considerate, and people are more aware of what's going on around them, which is great. It protects them, and then they avoid potential illness.
You mentioned a couple of moments ago that wearing masks for the last couple of years have actually helped in terms of allergies and our ability to avoid some of the more adverse reactions to allergies. And we do see people that walk around who have severe allergies that wear the mask. Is that more common now that COVID has come and people wear masks all the time anyway, that and people recognize now there's a value in terms of my allergies from keeping that mask on?
Oh, I'm sure there is. People tell me that. And you do see people out mowing their yard or doing yard work or stirring up dust and mold and that from the yard and the pollens, that yes, they're wearing masks now when they probably didn't beforehand. Mm-hmm. So that protection is excellent. The other thing that is very helpful with pollen is to use nasal saline to rinse your nose. I tell my allergy patients to rinse their nose morning and evening, or after they've been out for a walk, to rinse their nose with the nasal saline. Just like you wash your hands to get the dirt off, you rinse your nose to get the pollen out.
Yeah, there are those machines that help you do that, but there are just the squeeze bottles too, correct?
Yeah, squeeze bottles. There's pressure, little pressurized squirt cans that work very well. The saline without preservatives is less irritative to your nose, so I usually suggest those.
Yeah, and I would guess that if somebody is wearing a mask out there and they're mowing the grass, as you say, which is a great example, at the end of it, you're not going to put that mask right back on, because all of those allergens that have attached themselves to that mask are still going to be there, and you could be causing yourself some problems. So you have to keep that thing clean, don't you?
Exactly. Yes, you need to throw it away.
Yeah. Yeah, we're talking this morning with Dr. Al Johnson in Dallas, Texas. He's a doctor of internal medicine, allergies, COVID, whatever it is. Why are allergies so troublesome these days as opposed to in a previous day, 10, 15, 20 years ago? Allergies didn't seem to have the hold on our society as it does right now, but it seems like everybody has them. What's caused allergies to come up so hard against us?
Well, I mean, there's more people, number one. We are exposed to more indoor air irritants that irritate your nose, like irritants from scented products. Our houses are tighter, so if we remodel and there's paint fumes or carpet fumes, all those are irritating to the mucous membranes and can then cause you to be more sensitive to the allergies. So that's part of it. The other part of it is as we grow older, our immune systems tend to decline and allergies tend to flare up. So you see all those combination of factors.
I would guess then that filters around the home filters would be helpful, and so would immune boosters for people as they age as well. Right.
The vitamins, vitamin C helps. Quercetin helps. All the filters help decrease the pollens inside. Most definitely.
Mm-hmm. All right. So all of those things helping us to sort of get a handle on our allergy symptoms and therefore on the allergies themselves. Dr. Al Johnson, thank you so much for spending some time with us this morning.
Oh, you're entirely welcome. Have a healthy day.
You too. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. Nice of Dr. Al to come along and visit with us today.